Preterm labor. Preterm labor is labor that begins before 37 weeks gestation. According to the CDC, preterm birth currently affects 1 in every 10 infants born in the United States, which means 12% of all pregnancies experience preterm labor. There are many risk factors for preterm labor. Some of the risk factors include having a previous preterm birth, having a short cervix, a short interval between pregnancies, a history of certain types of surgeries on the uterus or cervix, certain pregnancy complications including multiple pregnancies or vaginal bleeding, lifestyle factors including low pre-pregnancy weight, smoking, substance abuse. More risk factors that can lead to preterm labor include black race, bacterial vaginosis, infections of the urinary and genital tracts, medical disorders such as hypertension, thyroid disease, diabetes, short cervix, or sexually transmitted diseases. At every doctor's appointment, the patient should be monitored for preterm labor symptoms. Some symptoms of preterm labor include a dull backache or pelvic pressure, edema or swelling of the hands or face, regular contractions, nausea, vomiting, diarrhea, and other flu-like symptoms, eye or vision disturbances, abdominal pain or cramping, reduction in fetal movements, leaking fluid from the vagina, or if the patient is worried, concerned, or does not feel right. To assess for preterm labor, the physician could perform a non-stress test to assess for regular contractions, perform a pelvic exam to assess for dilation of the cervix, assess for any leakage of fluid from the vagina, perform an ultrasound, and perform lab testing such as fetal fibronectin. Once preterm labor is confirmed, depending on the gestational age, the patient could receive corticosteroids to enhance the baby's lung maturity before delivery. The patient could also receive magnesium sulfate to decrease the risk for cerebral palsy, or the patient could receive tocolytics to help stop the contractions. There are many long-term complications that affect infants that are born premature. Some of these complications include cerebral palsy, impaired learning, vision problems, hearing problems, dental problems, behavioral problems, and chronic health issues.